Right, let's have an overview of pain management options for labour and birth. Now, again, there is a video going into all of these options in much greater detail, but I just thought it was worth having a bit of an overview of what's available and when in labour. So, TENS machines. I bloody love a TENS machine. I think they can be quite effective. The thing with the TENS machine is you need to book them in advance and use it from early labour. So it works by boosting your endorphins. So it works in the same way as maybe like a really good back massage works. And you could have that on throughout all of labour and birth for as long as you want to do it. And it can mean that you're more comfortable at home for longer. It can take the edge off kind of back pain. You know, it can be quite effective. So that's, I would say, really worth considering. It's 4 pads that you pop on your back. They're attached to a like a handheld unit that's battery powered, and you would start off on a low setting, and the idea is that you will switch that up as your contractions kind of intensify. So what's not to like about it, really? It's simple, but potentially pretty effective. And I like it because it's something you can have at home. Gas and air, so that can be given when you're in hospital. So most probably from when you're booked in, and it's a mouthpiece that you would breathe in and out of. So actually there's an image here. You can see the type of mouthpiece. Every woman in labour gets their own mouthpiece. And it comes down a long pipe, which is attached to the wall. So it's kind of a central tank. And you would just use it with a contraction. You don't necessarily need it with all contractions. You're in control of using it. So again, my own personal take on it is I think it's quite effective because there's a flexibility to using it and you get to be in control of it. It's not removing the pain, but it is taking the edge off and giving you something that can help you feel like you're working with your contractions, and you can remain mobile with them as well. Diamorphine is given in labour as well, usually by an injection, and that's an opiate. So that can be given in a small dose or a full dose. I think the only thing about diamorphine in labour is that until you have it, you don't really know how it's going to affect you. And once it's in your system, it's in your system. Some people I talk to talk really positively about it, like it really made a difference to them. And for others, they kind of maybe wish they'd had less of it, or they kind of question its effectiveness in their labour story. And it depends what you need it for as well. So having an opiate could be quite useful if you're having a long labour, especially a long early labour, and you need to rest, because actually it might put you to sleep for a bit. In a position that could encourage a baby to get into a better position. And, it could really work very, very well. So conversations like these with midwives are really, really valuable, depending on your individual labour story. An epidural, again, that's an option from when you're in established labour. So that is pain relief. That the aim of that is to remove pain. It's a local anaesthetic. So that's an injection in your back with a tube that feeds in the epidural drug, which is a local anaesthetic. So when it works well, it just works around your abdomen and it removes the sensation of the contractions. However, it doesn't ease or remove pressure or pain of backache. So that can sometimes still continue. That's not to say don't consider it, but it's just have an awareness of the bigger picture. There are limitations with it potentially, but again, you don't know that until you've had it. The downside that's always put against having an epidural is that it will remove gravity. Now, you most probably would need to stay on a bed. It's a low dose epidural, but its use with mobility is not necessarily, possibly unproven. It's a bit unpredictable. So care tends to be about keeping you on a bed. However, you can move around on the bed and you can have gravity where possible. So by using different positions to give your baby the space they need to move, and to allow your body to expand as it needs to for birth. And then the birthing pool, again, it's something to use from established labour. You're in control of using it. You can get in and out. You can be in it all the time. It is completely up to you and how it feels, and you're in charge with that. And you can have gas and air with the birthing pool as well. So they do go together quite well. So that's just a rough kind of overview. The other thing that's not on this list is the water injections, which some maternity units are now offering, and it's recently been included in the NICE guidelines, which is to inject water saline into spots on your back, either side of your spine, to reduce pain from backache. So that can be an option in early labour for women who are experiencing backache due to a back-to-back baby potentially. So that's another option. So it's worth finding out if your local unit offers that and how that works. The TENS machine is the only thing you could start really from early labour. Everything else works better. Well, no, diamorphine as well, but you'd need to be in hospital for that and in specific circumstances. But everything else is kind of with bigger contractions in hospital. These things are available. There are limitations to availability sometimes. Maternity units only have limited birthing pools. So birthing centres have more, but most maternity units might only have one or two pools. So that does give a limitation on availability. Epidurals are quite widely available. However, because an anaesthetist needs to administer an epidural, that can only be administered if there's an anaesthetist free and if you are in the right place in labour to have an epidural sited. So sometimes there's a bit of a juggle with that as well. A midwife can administer diamorphine, and that is available until you're pretty close to birth. Same with an epidural. So once you're at a point where you're feeling pushy and your baby's kind of at a point of leaving the womb and you're in the birthing stage, then the pain relief you've got is probably what you've got. You probably can't add to it with the bigger pain relief at that point, because an epidural and a diamorphine wouldn't be available if you hadn't had it already. So it's just being aware of some of these things and knowing how to consider them. It helps you plan in a more realistic way for what's available. And as part of your preparation, it's worth thinking that, if you know more about the potential limitations with the pain relief methods, then you can think about, well, if that isn't available, what are my options? And you can think about it in a more strategic way as part of your pregnancy and your birth prep, just so that you've thought about it, rather than sometimes I can work with expectant parents who don't really want to think too much about things like an epidural, because it's, well, I don't want one, and I don't want to think about that, which I totally get. However, it is important to think beyond your ideal labour and birth, and an epidural might be what's needed. Um, to me, if you haven't thought things through a little bit, and if you don't have information, then you've got limited options. And I'm all about you having as many options as possible, and just kind of having even just a basic understanding of what some of these options are. So, the end of your pregnancy is the time to be thinking some of that through and thinking about alternative strategies, just in case there are limitations with what you can have. Therefore, how do you proceed forwards? I'm all about planning and preparation. So make notes, jot down questions, because that's a good place to focus your birth preparation.